curious as to what you have access to in Japan. I mean, obviously people know Japan for their seafood, and there's a lot of pork in Asia in general. And, I mean, we've all heard of the Wagyu specific beef there. That's very much a delicacy there. But what do you typically eat day to day now on a carnivore diet?
On a daily basis, I'm pretty time poor. So I'm just eating some simple foods. Like I eat about 10 eggs a day with some cheese and about 600 grams of ground beef, which is about, I guess, just over a pound.
Mm-hmm.
And I'm only eating once a day. So like I eat breakfast and then I'm satiated. I don't eat again until the next day.
And how has that affected? I mean, obviously you mentioned the effect it had somewhat on the arthritis, a little bit on the stroke symptoms. Any other effects you've noticed?
Sure.
Gut health, skin, cognition, anything?
Yeah. So clearer skin, feels like I've got stronger nails and teeth, no more flatulence. As I mentioned before, I used to be a public speaking trainer, and I'd be walking around the training room, especially after lunch, always worried about I'm going to let one rip if I have to bend over and pick something up or something like that. That's gone. I had gum disease, that's gone. And the only reason I noticed the gum disease was gone is when I would get close to someone and talk to them in the past, they would, suddenly recoil because of the smell. Mm. And that doesn't happen anymore.
Yeah. So that's important because, you think about how diet impacts. If your teeth are rotting out of your head on a diet, it may indicate that the diet's not the right diet. Right. So I think that's a pretty good sign there. What is, you've been doing this now, what, 6, 7 months? I can't remember when you said you started the carnivore.
About 6 months.
6 months now. So maybe not long enough to, but I'll ask it anyway. People around you, family members, friends that know you, I don't know if you've been to the doctor since then, but any interaction with people and any thoughts about that?
So family have just kind of accepted it. My wife's a nurse, so everything she's been trained is kind of counter to what I'm doing, but she can see the results, so she's happy to support me. Friends, fine. We can still go out, we can still socialize and stuff without me needing to partake in, for example, if they're eating, pizza or something like that, I can quite happily sit back and we can still enjoy the socialization without me having to stuff my face,
Yeah.
It took me a month to kind of get over that, right? So I kind of avoided social situations for about a month or so to make sure that I wasn't going to be tempted. But now I've just got no temptation at all.
Your wife, was she trained? I mean, where is she from? Japan, or where was she trained at? Where did she learn her medical?
Yes, she was trained in Japan. She's Japanese.
She's Japanese. Okay. And so even then she was trained that, hey, don't eat a lot of meat. It's kind of bad for you or something along those lines. And, I mean, does anyone even know of the carnivore diet in Japan? Does anybody talk about it, or is it a completely unknown entity?
Yeah, it's completely unknown. Like I tell students about it now as a discussion point, because it really starts to get them to talk if they're if they're reluctant to speak in English. And they're all shocked. Everyone is like, you can't do that. You can't, this is, how are you still alive?
And so so you say your students, are you teaching Japanese how to speak English or something? Or what are your students, what do your students do? Speaking?
Yeah, that's right. Teaching Japanese students English.
Okay. Yeah. And so it's kind of interesting that, when the first, like it's almost like 5 or 6 years ago in the US when I was out here saying I'm just eating meat and people thought you're going to die, and I'm like, no, I'm not, I'm fine. I'm still here. So it's kind of an interesting thing. So, have you had any struggles or challenges with this, either just in general or any actual physical problems associated with the diet?
No, I mean, to be honest, it's all been positive. The biggest struggle I could say is like my concern about going to see the doctor after I got my blood work back from my yearly physical. So my LDL is elevated, of course. So I got a score of D on my physical exam because of my blood work. So yeah, I'm a little bit concerned about going to see the doctor. Apart from that, no problems.
So when you say D, you mean out of an A, B, C, D, F, you fail type of score, or they gave you a D solely because your LDL cholesterol was elevated? Were there anything else that was concerning that they thought, or was it just LDL?
No, everything else is all right. Everything else is improved on the my triglycerides are higher, but it's still within it's still not crazy high. But everything else is improved. My weight's improved. Everything.
Yeah. That's not uncommon. We see that everything improves except for this one biomarker. And the next kind of question is that the same as a high LDL in a person, eating a junky diet with everything else a problem? And I think it's still unclear. Well, let me just delve on that, because you've seen clearly, it sounds like you've seen a positive quality of life improvement. Is that fair to say?
Definitely.
Yeah. And so some people would say, well, that's good and all, but you've increased your risk for heart disease. What do you say to that? Even if that were true, would you say I'd rather take the quality of life and take my chances with the heart disease? Or what are your thoughts on that?
Well, the first thing is, yes, I would rather take my chances because of the quality of life improvement. Just from the mental kind of feeling, like with the brain fog and the, tiredness and stuff like that, not having any of that anymore, that's enough of a reason to take my chances. But I think the second thing I would say is, when you actually think about how we would have evolved, it just makes, and how other animals are in the wild, it just makes no sense that we would actually be meant to eat a balanced diet.
Well, I've made this point all the time. How do you, most of the stuff they recommend doesn't even grow anywhere near anybody. It's like you've got to import it from 6 continents to make a balanced diet that they're recommending these days. And, it's like every single creature on earth that consumes meat, like a lot of animals, none of them get chronic disease. It's like no one else. It's like, why would it be unique to humans? We've clearly eaten it since the dawn of humanity. We've been eating it. And all of a sudden now it's like, oh, it's bad for you. Makes zero sense to me, but I'm just a stupid orthopedic surgeon. So what do I know? Anyway. Okay. So let me ask you about, as far as any other practices that you're now engaging in that have used to improve the quality of life. Again, this is interesting because it's, stroke rehab is something where, I don't think nutrition plays a big role, other than they'll give you the standard, eat a low fat, balanced diet, kind of stuff, but no specific stroke diets that I'm aware of, or at least that are not very that are talked about by the general population of neurologists and other people that care for stroke rehab specialists and so on and so forth. But are you focusing on anything else? Sleep, exercise, any of those other things making it into your routine now?
I'm exercising a little bit more. Like, I'm in Japan and I don't have a car, so because the train system's so good, so I'm always walking a lot anyway. Like I've always walked about an hour to an hour and a half a day. But I've noticed since I've been on carnivore that muscle seems to develop much quicker for me. Like, I don't know what it is, whether it's just like the recovery is faster or something, but muscle really seems to develop faster. So I've started doing things like push-ups and crunches and just some simple routines to kind of help that muscle along.